Something the Obama administration would like to say goodbye to in 2014. Jonathan Grubered, but even more controversial comments are coming to light. The Obamacare architect who called the American people stupid reportedly said back in 2009 that the health care law would not be affordable because it had no cost controls, and that the only way to control cost is to deny treatment. In a policy lecture undercovered by the Daily Caller, the MIT economist said, quote, "The real substance of cost control is all about a single thing, telling patients they can't have something they want. It's about telling patients that surgery doesn't do any good, so if you want it, you have to pay the full cost." The latest comments from Grubered follow the 6 times he was caught on video that we know of, describing how the American people had the wool pulled over their eyes when it came to passing Obamacare. And get this, all of Grubered's blathering about the health care law has sent him to the very top of the Economist's annual list of the most influential economists. Influential indeed. You know, the right can't get enough and the left hopes that he goes away immediately. But let's talk about some of the stuff that he brought to light with these latest comments we're discovering from 2009.
It's true, though. Ultimately, you can't have all-you-can-eat health care. That something's got to give. The big question, and how long it takes for us to come to this realization, remains to be seen. But ultimately, the question is, who's going to decide what is an elective surgery? What is optional? Who gets to make that decision? I expect, because the Medicare Trust Fund, and that is single-payer, because that will go broke in 2030 is the new date, a little bit longer than previously thought, that the focus will be on Medicare first, and there will be so much outrage. He's not off base by saying that.
Yeah, and who are the ones who decides who lives and who dies, who gets the life-extending treatment, and who has to go broke paying for it?
That's what's scary. I don't want to leave that in anybody's hands to decide what surgery I get to get.
Yeah, we saw what happened in the VA hospital, right?
Yes.
That's exactly what was happening. They were deciding who's going to get an appointment and who's not. And I will say he's not the most influential man because he's the most well-liked. It's because his name was searched when you searched Google, or the number of articles when his name popped up. That's why he got #1 on that list.
He got to shut his mouth, though. He's got loose lips, and he's letting out all the secrets.
Oh, I want him to keep talking.
Oh, no, I don't.
More. I mean, this thing was called the Affordable Care Act, and he's essentially coming out and saying that while Obama was trying to sell this to people as something that was going to bring costs down, the only way they could do that was by denying treatment. Remember when Republicans were talking about death panels with this independent payment advisory board?
And we're derided
and we're laughed. Yes, Sarah Palin, they were laughing at her. That's exactly what's going to happen, because you can't pay for everything, and they structured a system that's not cost
effective. Well, it is Sarah Palin, so it is easy to laugh at her, just to be fair.
Okay, but he also said that the president came out and said your premiums will go down, and Grubered admitted in these 2009 comments that that was a lie. That the president was saying that, and that's not true. And basically what he's saying is it would be great if it was true. But let's not focus on the lie. Let's focus on, 48 million people will be insured, which also not necessarily.
And it's in the years to come that people's health insurance and the way that they are treated at doctors is going to change. That Cadillac tax of 40% excise tax on kind of high-end health plans, that doesn't kick in and for another 3 years until 2018. What's going to happen there is companies are going to be reducing their health care benefits. You're going to, if you get more money in salary, you're going to be paying extra tax on that. So your health care is going to change.
It's going to be more expensive, and it's going to go down.
Well, first he called us stupid, and then this broke this morning, in addition to what you were saying, him basically calling the Affordable Care Act not affordable. He also said, quote, "We don't care if 50 million, meaning we Americans, don't care if 50 million don't have insurance." So now he's calling us insensitive.
Sharon, how do you think people feel when they hear this stuff, though? Do they care about all this? Do they care about the deception, or do they just care about what the policy actually looks like in their life?
I hate this phrase, but people at the end of the day, all they worry about is what they're going to pay for health insurance. And if the stuff that they need is going to get covered, as far as like medical or medication or like surgery or whatever. So all the jargon, it's like, it seems like we got kind of, confused.
They also care about the doctor. If they have a doctor
and the right doctor.
And half my doctors here in New York City don't take any health insurance. So you've got to pay cash up front. So it is a choice. It's like, I'm going to buy this and, go get a breast biopsy for people.
But it turns it into a bifurcated system. It is the haves and the have-nots, unfortunately. And, you know, if you had a pretty good system, 86% of people were happy with their health care before the passage of the ACA.
Here's the thing. What is Canada doing? Can't we do what they doing?
They started privatizing their health care system and their clinics. They had to go to a private model in order to have economic growth and freedom. And Canada is now existing more freely in the health care field than we are.